Hello there, everybody. This is Ask Dr. Bob, and this is where you ask me, Dr. Bob Gebe. I'm the Chief Scientific and Medical Officer for the American Diabetes Association. You ask me questions about diabetes, and I do my best to answer them. So each month, if you're new to the program, we pick a topic, a theme, and people send in questions. I already have some questions, but feel free to throw in questions in the chat. Also, I'll say if you like this and you are new to this, um, you know, we do this every month. You can find us on social media. I'm on Twitter, Facebook, and LinkedIn, Dr. Bob Gebe, and so I'll share lots of other interesting things for you as well. So, what is the topic today? And it's a really interesting one. It's where are we towards a cure, curing diabetes? And so a lot of questions that I got already, and I'm sort of going to get into those. But again, if you have questions about curing diabetes, throw them in the chat, and we will go from there. So let's get started. Um, so here's the first one. How close are we to a cure for diabetes? So let me talk a bit about that. I think we're definitely getting closer. Um, and I'm going to talk about both type 1 diabetes and largely type 1 today, but we'll talk a little bit about type 2. So, just to say, for type 2, we don't think about it as a cure for type 2, but having people with type 2 diabetes go into remission. Remission means that they don't have active disease as far as we know, but we don't say that they've been cured because we want to still follow these individuals to make sure they don't develop any complications of diabetes. So that's the type 2 diabetes story. It's really about remission and not cure at this point because we don't know long term what that means. So we call it a remission. So now let me switch to type 1 and how close are we? Well, let me tell you the two approaches, the two most promising approaches that people have been working on for a number of years. The first, so remember, the type 1 diabetes is essentially a disease where your body doesn't make any more insulin. And that's the main problem. And so the cures are, how do you help people make insulin again? And the two approaches have been one about transplanting cells that make insulin, islet cells, and they'll talk about that in a moment. And the other big area where moving towards a cure is, can we have sort of like a biomechanical cure? Can we create a contraption that delivers the right amount of insulin and you're sort of on autopilot? It's not exactly a cure, but it's close in that you don't have to do anything. You sort of use this thing, sometimes called an artificial pancreas, and you don't need to think about it. So it's either giving you the parts of the pancreas that you are missing, and that's the transplantation, or some device that will do the work for you. So that's where we are, and there's a lot of progress on both, and we'll talk about it in a moment. So, which leads to the next question, and I sort of organize these questions so they sort of tell a story. And so this one is, are stem cells a possible cure for diabetes? And yes, they are. And let me tell you the story about stem cells and what they are. Uh, so, you know, uh, uh, if you think back to the earliest form of humans, right? There's an egg and a sperm. They form an embryo, and in the embryo are cells that can turn into many different things. Like, some of them turn into skin cells, some into liver cells, some into the eye, whatever. Those cells that can turn into anything are called stem cells. They're the stem of all of the other um, uh, parts of the body. In essence, that's how we're formed. And so those are stem cells. And in the old days, we used to say, well, we could, from embryos, we could obtain some of those stem cells. embryos that were lost for a variety of reasons, and then transplant them. But now we don't have to do that anymore. So some of the concerns about stem cells, not an issue anymore. And here's the incredible discovery that people have been able to make. Um, they can take one of your cells, let's say a blood cell, uh, and make it go backwards to the earliest form of cell, to be a stem cell. So they can create stem cells from your cells. They go backwards in their development. That stem cell then can be grown into a beta cell, a cell that makes insulin. And so we now have the ability to create unlimited numbers of these stem cells from an individual. So that was really the big challenge, and so we can now make cells that produce insulin, and they can be transplanted into people. So the question of, are stem cells a possible cure? Absolutely. If we can put enough of these cells that make insulin into somebody, um, then we're in business. So why don't we have a cure? I know that's the question that you're all asking. And let me explain a little bit of what the process has been. So problem number one was having enough stem cells, and so we've largely solved that through some great research. Some of that has been what American Diabetes Association supported to get us to this point. So we have enough stem cells. The problem is if you transplant cells into the body tends to reject any foreign entity. And that's very helpful, because if those cells were bacteria cells, for example, well, you want to be able to destroy them. That's what our immune system is for. So the challenge with transplanting stem cells is that they'll get destroyed by the immune system. So there are two ways around that people have explored, or actually maybe three, and we can sort of talk about that. One is, um, can can you put somebody on immunosuppressants, drugs that suppress the immune system? And yes, you can. And then you could put those stem cells in, and stem cells that have been grown to be islet cells or beta cells, and put them back in somebody, um, and that works. And so there actually been trials last year at our big diabetes meeting, scientific sessions. We heard a presentation, and we'll hear more this year in June at our annual meeting, of human trials putting stem cells grown into beta cells and transplanted into people. And there's been one individual that was insulin free, that though they've transplanted enough of these cells that they didn't need uh, any insulin. And in essence, they were cured. So very exciting. So that's how close we are. So one process is being on immunosuppressive drugs to suppress the immune system. The problem is those drugs are dangerous. Uh, they suppress the immune system, and you need your immune system to fight infection. So there's really a higher risk of infections and all of those problems. So that's that piece of it. Um, let me go on to the next question. The next question is, how about pancreas transplantation? Well, yes. So pancreas transplantations are a cure, and they've been around for quite a while, like 15 or 20 years. So why isn't everybody getting a pancreas transplant? Well, big problem is there are not enough pancreases to transplant people, all the people with diabetes. In fact, there are very few pancreases to transplant, and that's why they've been working on creating these stem cells that grow into pancreas type cells, because there are not enough pancreases. Uh, and the problem with pancreas transplantation is, again, you need immunosuppression, and that can be dangerous. So the people that tend to get pancreas transplants now or people that need another transplant, so kidney transplant. Someone has kidney failure from diabetes, they get transplanted a kidney, and now you can put a pancreas in at the same time, and it's sort of a two for one. So that's the big approach that's already available, but again, the immunosuppression. So you might say, well, okay, so we can transplant people and cure them, but we have to use the immunosuppressive drugs that are not so great. So what's the answer? And there's some really exciting science on that. And there have really been two approaches. One is to put these cells that you're transplanting into a little a barrier, something that lets blood flow get in to feed these cells so that they can stay alive. It allows the insulin to get out, but it doesn't allow the immune system to get inside this little pouch. And that's been successful, and there have been some trials in humans with that they work for a little while. And so that's another way to, and then you don't have to be on the immune transplant drug. So that's one way to get around it, and a potential cure. And then the other way has been using technology to change. So we now understand a little bit about what is it about these cells that get transplanted that make them look foreign, and can we make them look not foreign through genetic manipulation? And that's an area of active research. Okay. That was a lot. If you're just joining in, this is Ask Dr. Bob. I'm Dr. Bob Gabbay, Chief Scientific and Medical Officer here at the American Diabetes Association. We're talking about progress towards a cure. And so let me get to the next question, and that's, and again, throw your questions in the chat. Are there new advancements coming soon that can make management of diabetes even simpler? And yeah, there's a lot. And one is really something we already have, and that's continuous glucose monitors. And those have really helped people to know how their blood glucoses are doing. And those have now been connected to insulin pumps to do automated insulin delivery. And we'll talk about that in a moment. So that is some really exciting work that's happening. I talked a little bit about people with type 2 diabetes uh, through either weight loss are able to be placed into remission, where essentially their blood glucose levels are normal. It's almost like a cure, but that's what we are working on, and have some treatments that work for helping people with type 2 diabetes go into remission. So the next question is, what about an artificial pancreas? And that word's used to say a lot of things, to mean a lot of different things. And what I like to use, and what we use, is the term automated insulin delivery. So in other words, you have a pump, there are insulin pumps already available, and how can you make that delivery of insulin automated so that the person living with diabetes doesn't need to do anything? Well, we're close, and there are three different automated insulin delivery devices out there. One by Medtronic, one by Tandem, one by Insulet. And what they do is they connect an insulin pump with a continuous glucose monitor. So the blood glucose measurements are being made. It tells the pump, here's what the blood glucose is. If it's high, give more insulin. If it's low, give less insulin. And so there are already three of those on the market, but they're not totally automated yet. So what do they do well? They do really well at overnight controlling your blood glucose. And during the day, your blood glucose is really dependent on what you eat. And they don't know what you're eating, so they can't really adjust for what you eat. So people that use these devices have to tell the device, I'm about to eat 30 grams of carbohydrate or 15 grams of carbohydrate, and that helps the device give what should be the right amount of insulin. So it's close. It's close. It's not fully automated yet. And then the question is, what would it have to do to be fully automated? And here's where a couple of things come up. Um, so one, it would have to have a way of either knowing exactly what you're going to eat, which is hard because you don't always know exactly what you're going to eat. I don't when I sit down in front of a plate of food. I might finish the whole plate, I might not. So it needs to have some way of adjusting for what you eat. Um, and the problem is, if it waits for your blood glucose to rise, uh, because the insulin that is delivered is not into the bloodstream directly. You know, when someone injects insulin or uses insulin with an insulin pump doesn't go directly into the bloodstream. It goes into the subcutaneous tissue, and it slowly has to then get into the bloodstream. So there's a little delay. That lag becomes important if you're trying to deliver the right amount of insulin at the right time. And that's a challenge with these current devices. So if you could reduce that delay, and there are people working on insulins that could be absorbed quicker. uh, they're working on ways to measure glucose in the bloodstream instead of what's now in the subcutaneous tissue. So reducing that lag time so that the data is really like immediate. So you know exactly what the blood glucose is now, and 5 seconds later and 5 seconds after that, and you deliver the insulin as quickly as that. That is another potential cure. So a lot of exciting things happening um, in looking for a cure for diabetes. And thank you for asking your question. So let me try to recap quickly, and if there's time for maybe one more question, if someone wants to throw something in. Um, so we're on a cure. We're either looking at transplanting uh, cells that are grown from stem cells that produce insulin, and we now have a way to make unlimited numbers of insulin-producing cells. We can transplant them in, and that's already been done in human trials in a small number of individuals, but the immune system gets in the way. And so there are different efforts to try to either fool the immune system or protect these cells from the immune system. So that's one potential cure. And the other is an artificial pancreas that automates everything and takes care of it. And looks like I have one quick question. How long can someone stay on immunosuppressive therapy? Yes, that's a great question. So, you know, in theory, there's no limit. You can always, people stay on immune suppressive drugs, and anybody that's had a transplant really has to. So if you think of kidney transplants and heart transplants, those people stay on immune suppressive drugs for life. And they need to, because as soon as you stop them, the immune system wakes up and starts to destroy those organs. So similarly, so far for what has been transplanted to cure diabetes, um, and that's why we're working, and scientists around the world are working on solutions that you don't have to stay on those immune suppressive drugs. So, um, thank you for listening today. We've been talking about where are we towards a cure. Long ago, you know, people have probably, a lot of my patients say, you know, they told me when I got diabetes that within 5 years they'd find a cure. We don't like to say when that cure will happen because, you know, we don't know, but you can see we're getting closer. You know, we're knocking down the different challenges and obstacles to getting towards a cure. So we're all very hopeful. The American Diabetes Association supports research for this with your support, and our hope is that we will find a cure very soon. So thanks for joining Ask Dr. Bob. Tell your friends, families, colleagues about us. We'll be back next month, and follow me on Twitter, Facebook, and LinkedIn at Dr. Bob Gabe. And till next time, be well.